Actually, vaccines are injected into the body, and once they are in the body, it produces antibodies. These antibodies help in prevention of infection. That is the basic principle of all vaccines. And vaccines have been very important in prevention of infectious diseases. There are three major pillars to prevention of diseases: hygiene, nutrition, and immunization. Immunization has helped the world a lot. Smallpox like diseases has been eradicated from the world because of vaccine. Lately, India has been declared polio free. It's just a tribute to the vaccination programs that is being carried out. Some of the major diseases prevented by vaccines are diphtheria, whooping cough, tetanus, polio, then chickenpox, measles, mumps, rubella, hepatitis B, hepatitis A, typhoid. Then some forms of meningitis like meningococcal meningitis, HIV meningitis, pneumococcal meningitis also can be prevented by the vaccines available today. Yes, vaccination starts from the newborn period. The first vaccine is given even before a baby is discharged from the hospital, immediately after birth. After that, your doctor makes out a schedule for you. This schedule varies from country to country. We have a schedule for our country of the regular vaccines and certain additional vaccines that are available. Your pediatrician or your doctor will always give it to you when you start a vaccination program. You must follow the schedule regularly, routinely, and on a long-term basis. Some of the vaccines are given till late age and one must follow it. Just stopping the vaccines midway is not good. Most of the missed vaccines can be given. It is generally not necessary to restart the vaccines. If you have missed a dose, it can be given at a later day, and most of the time we only make up for the lost dose. There is no need to repeat the vaccination and it can be given. Majority of the times there is no side effect. Some of the vaccines do cause a little bit of like DPT, cause a little bit of pain and fever, and they are looked after by simple drugs like paracetamol, and very rarely you have a serious side effect to vaccine. Vaccines are in general very safe and time tested. The routine vaccines are not costly. There are various varieties of the vaccines, like in DPT also you have two types of a whole cell and the acellular vaccines available. Whole cell vaccine is very effective but quite cheap. Most of the government hospital dispensary use the regular vaccines on a regular basis. They are very effective. They are not at all costly. Some of the vaccines are costly, but most of them are the additional vaccines, and if you opt, you take them. Otherwise, it is up to you. But the regular vaccines for prevention of major diseases are diphtheria, whooping cough, tetanus, measles, mumps, rubella, hepatitis B are not at all costly. They are very simple vaccines. Well, you see, what is very important today is most of the time children are taken for vaccines regularly up to 3-4 years of age. After that, one generally misses the vaccines. They feel it is not important. Either they have not been advised properly or they take it too easy. That is important. Most of the vaccines, lot of vaccines require repeated dose at regular intervals, like tetanus vaccines and all, and one should follow up with the doctor. These days we have an adolescent vaccine program. Even adults need some vaccines, and one must take care to follow up with the vaccines and not forget it after 3-4 years of age.